really familiar.
Yeah, I think we were here last year.
Trick or treat! Ah! The last! Run!
I can't understand this fear of no masks. Here I am, last February, at the beginning of the pandemic. I didn't need a mask. Someone said masks make you look weak. I have survived the pandemic just fine, and you can see that I haven't changed a bit. So what's with these kids? And even my dog took a look at me, and now he's joined the crowd. Look who else has joined the crowds. Pumpkins. Even our presidential candidates. Yes, that last one was a difficult picture to find. Okay, it's time to get serious. Do masks really convey weakness? Let's look at some of the culture around masks. Here's some photos of people in masks who obviously aren't conveying weakness. The Lone Ranger, Batman, Deadpool, Lucador, The Flash, Black Lightning, and Zorro. What's happening with COVID-19 in Arizona? Well, the number of Arizonans confirmed or suspected of COVID-19 hospital inpatients was reported on Friday, that's last Friday, at 815. That's 39% higher than October 1st, when it was 586. The number of patients in intensive care unit beds ticked up to 172. That's 37.6% higher than October 1st, when it was 125. Arizona's weekly percent positivity rate for diagnostic testing, an indicator of how much the virus is spreading in the community, is on pace now to be the highest seen in more than 2 months. The past several weeks have seen relatively higher daily case reports as the virus spreads at its fastest rate in Arizona since June. On Sunday, that's Sunday, October 25th, the state reported 1,392 new COVID-19 cases. So here's a map showing the cases in each county in Arizona reported last Friday. That's Friday the 23rd. So as you see on this map, Maricopa County, of course, has the most cases by far, but the percentage of residents in Maricopa County does not make that county the most highly infected county. For that, you have to go up into the northeastern part of the state in Navajo and Apache County with relatively smaller populations but significant percentages of the population infected. And you can see some of the other counties there. Greenlee County with a very small number of cases, even a small population, but a relatively small percentage of the population infected. But overall, in Arizona, as in the nation, the rural counties of Apache and Navajo are the hot spots. So just as in Arizona, the two rural counties of Apache and Navajo are the hot spots, so nationwide the trend is that rural counties lead as being hot spots. The New York Times reported on Sunday the hotspot counties are in North Dakota, Montana, South Dakota. Those counties are leading the nation now in new cases. Given the increasing community spread in Arizona, our Department of Health Director, Dr. Kara Christ, fears an outbreak is coming. Dr. Christ said the number of coronavirus cases and the percent positivity for diagnostic testing has been rising, and she said now is not the time to stop wearing masks and start resuming normal activities. She has a fear, especially of an outbreak occurring after Thanksgiving when people get together and celebrate. And especially she emphasizes, don't let up on the mask wearing. Now, let's discuss the mask wearing. We have known masks slow virus spread since the flu epidemic in 1918, as you can see in this picture of mask wearing from almost 100 years ago. Remember, the virus itself is just coming up on being a year old, and research is advancing our knowledge of mask use. A study published in August by infectious disease physician Dr. Monica Gandhi, she published an article entitled "Cloth Masks Do Protect the Wearer. Breathing in less coronavirus means you get less sick." This is a very significant study because laboratory experiments have now shown that good cloth masks and surgical masks can block at least 80% of viral particles from entering your nose and mouth. In other words, a mask protects us from potentially being infected. So originally we were wearing them primarily to prevent us from infecting others. Now we're realizing mask use also diminishes our chance of being infected as well. So these new studies coming out are increasingly showing the importance of masks. I've attached links to some of these new studies in August and September that have just come out. How many people actually use masks in our country? Across the United States, mask use has held steady around 50% since late July. This is a substantial increase from the 20% usage seen in March and April, according to data from the Institute for Health Metrics and Evaluation at the University of Washington in Seattle. And I've included the link to the study with that data. The Institute's models also predict that, as of September 23rd, increasing U.S. mask use to 95%. Now, we won't get there, but if that did happen, a level observed in Singapore and some other countries, if we did that, we would save an additional 100,000 lives in the period leading up to the end of the year, January 1st, 2021. If we went to 95%, we could save 100,000 lives. Now, some have argued they don't believe this research because we don't have randomized trials with control groups not wearing masks being exposed while some people do wear masks. Well, we didn't have control groups when we tested parachutes either. We didn't have people jumping out of planes without parachutes to see if they worked. You know, who's going to be in the control group that doesn't wear a mask? So, no, we don't, but we have advanced knowledge now from newer studies. And those studies say it's worth enforcing mask usage where we can. And where can we as administrators do that? In our schools, with our students, and with our staffs. Let's do what we can. Let's mask up.